All right, it is 12 o'clock, so I'm going to get started here today. Well, first of all, welcome to our June Lunch and Learn webinar. These are held every month as long as we have someone who can chat. And keep an eye on our events page for all of our upcoming happenings. Today, we're going to hear from a recent Millersville University graduate with a degree in archaeology and current LGH-sponsored intern here at the Lancaster Medical Heritage Museum, Haley R. Haley has spent the last month or so researching the history of anesthesia, and she is going to discuss her research with us today. So, without further ado, I'm going to pass it over to Haley and let her begin her presentation. Haley, it's all yours.
Hi, everyone. Thanks so much for coming today. As Kim said, my name is Haley R., and I will be presenting on anesthesia, the turning point of medicine. If it'll go, I'm sorry. There we go. So what is anesthesia? Anesthesia is used to prevent pain during surgery. It is administered via injection, inhaling it topically with the spray, using eye drops, and using skin patches. It's used for different types of surgery as well. So there's local surgeries that just numbs a small part of your body. So if you're getting a tooth pulled, wisdom teeth surgery, anything like that. Regional covers large areas of your body. So if you're getting work done on an arm or leg or anything like that. Or there's also general surgery. So that is when your whole body is you're unconscious and you're unable to move during major surgeries. This quickly replaced many previous methods for surgery. Previously, people used drugs like opium and alcohol. They were physically knocked out. People tried hypnotization, which was considered incredibly unreliable, even considering the other methods were also unreliable, or they just did nothing at all. You were given a cloth to put in your mouth to bite down on. They encouraged screaming, they encouraged yelling to help with the pain. And because of the lack of anesthesia, this is where the idea of surgeons being heartless or cold during their patients and during surgery comes from. People had to sort of shut down when they were performing procedures to kind of protect their patients and to protect themselves. Some side effects of anesthesia. While using ether, patients felt a choking sensation and had to be held down. People felt aggressive and had to be held down. The odor is irritating, as well as the gas itself on your skin. So use of cages to hold cloths were very important. Some concerns around anesthetics included heart rhythms, breathing problems, allergic reactions, confusion, and awareness during surgery. That can include smelling, burning during surgery, feeling some sort of pain, starting to wake up, anything like that. Surgery is already an incredibly traumatic thing to your body, so making sure nothing bad happens while under is an incredibly important part of surgery. Ether was originally discovered in the 16th century by Valerius Cordus. He was a botanist, and he mixed sulfuric acid with fortified wine to make sweet petroleum oil. It came in drops, and it was used mostly for muscle spasms. It made you sleepy, and it kind of knocked you out. Like other doctors who were using anesthesia at first argued that there might be other people who came before Cordus who invented anesthesia or the use of it. But because of how long ago it was, it's hard to tell. He also died at 30 years old, so many of his works and all of his research was published posthumously, so that kind of makes it hard to understand what was happening. Ether was used at ether frolics mostly for a long time by medical students recreationally. This is where Dr. Crawford Long observed the use of ether he noticed that students who were inhaling it weren't feeling any pain when they fell down or they were hit. They were just kind of carrying on with their evening. In 1847, around the same time ether was beginning to be used in 1846, Dr. James Young Simpson felt that chloroform was the better choice. It smelt better, it was cheaper, more effective, and less irritating. However, chloroform is not a popular use of anesthesia because it caused many deaths due to respiratory failure and cardiac arrhythmias. Ether was used up until the 1950s to 60s when new, less flammable anesthetics came to use. Some examples of non-flammable anesthetics include halothane and sevoflurane. Ether is still used in third world countries today because it is a very effective choice of anesthesia, and it's also cheaper than what you would find for medical use. Here are just some examples of bottles of ether. Red labels mean poisonous. It says here poison and poison, but this is something that we look for at the museum here when we're going through the medicine that we find that was popular for people to take. This is a chloroform tincture, just an example of it. Ether masks were a metal cage, like I mentioned, that held a cloth to breathe in. Oftentimes they were pretty small, just big enough to cover your mouth and your nose. And it closed over the cloth to protect your skin from the irritation. The Ormsby inhaler was invented in the late 1800s. Inhalers in general allowed for temperature control and control of how much was being inhaled. By the end of the 19th century, France invented a bag using a stomach lining of an animal that connected to a metal cage as well, and they used that to control how much people were inhaling. Dr. Joseph Warren Horton invented the intercoupler that acted as a grounding device during surgery to avoid ignition of anesthetic vapors. On the next slide, I have an image of that, but it hung from anything, and it had 4 wires, and one wire would connect to the patient, one would connect to the surgeon or the anesthesiologist of sorts, another would be connected to the table, and one was on the ground. This just helped with the ignition of sparks during surgery to keep the patient and their surgeons safe. After new anesthetics came around in the 1950s and 60s, revision of standards were put in the 1970s, banning all use of flammable anesthetics to protect everyone. So over here is an example of the Ormsby inhaler, the bag and the mask. On the bottom is an example of the French bag that was used. And up here is the intercoupler with the wires that hung down and attached to everyone. We have one of these in the museum actually that I cataloged, and that helps me understand a lot of tools that we need for anesthesia. Getting into important people involving anesthesia, Dr. William T.G. Morton was a dentist from Massachusetts who wanted an alternative for nitrous oxide for his procedures. Nitrous oxide, also known as laughing gas, is still a popular anesthetic. However, it's not very strong, so he wanted something that could be used instead. He went to Connecticut with another dentist named Horace Wells, and they were partners for some time. The family of the woman he wanted to marry did not like that he was a dentist, did not approve of it, and would only allow him to marry her if he became a doctor. So he attended Harvard Medical School, but he never graduated. At Harvard Medical School is where he met Dr. Charles Jackson, who I'll get to soon as well. And he taught him the use of ether. On September 30th, 1846, Morton performed a painless tooth extraction, and this was documented and people were hearing about it very quickly. And on October 16th, 1846, Morton and Dr. John Collins Warren performed a surgery on someone's neck. They removed a tumor without any pain, without any suffering of the patient, and they removed it effectively. Morton did try to hide the identity of ether by patenting it under Lithion, It just was not very successful. By the time he tried to patent it, many people already knew the inhalant was ether. And Dr. Charles Jackson, Dr. Wells, they were fighting on the credit of the inhalant. They wanted to be given the credit for it. Dr. Charles Jackson felt that he deserved the credit of it because he was the one that taught Morton. In 1852, he was granted an honorary degree from Washington University of Medicine in Baltimore, or the College of Physicians and Surgeons. Up until that point, he spent years fighting for the patent to be accepted. He went to Congress to kind of try to get any compensation from the patent. He felt that the patent was necessary because he wanted people to use it properly. He didn't want everyone to abuse ether, but everyone felt that it was unfair to patent a medical discovery to make it more expensive than it needed to be, and to kind of keep people from it in a humane and scientific field like surgery and medicine is. Due to a cerebrovascular accident, he ultimately had a major stroke and died in New York City. He was in a carriage with his wife, and he insisted they needed to pull over so he could jump into the river and cool off. And he was taken to the hospital, and the doctor who was working on him said, "Young gentleman, you see lying before you a man who has done more for humanity and for the relief of suffering than any man who has ever lived." Because he actually applied what he was learning. That was what separated from him and Jackson. He applied it, and Jackson was merely teaching it. So he felt that he deserved everything. Here are just some pictures. This is Dr. Morton on the left. Down on the bottom is him performing a tooth extraction surgery. You can see the cloth is over the nose and the mouth. That's so you're constantly breathing the gas in. Once you stop breathing it in, it starts to leave your system and it gets weaker and weaker, and that's when people start to suffer. And on the top is his grave. It says, "Discoverer and demonstrator of ether anesthesia, notable contributor to the advancement of surgery." And it was the first public demonstration at the Massachusetts General Hospital, October 16, 1846. The Massachusetts General Hospital was a major game changer as well. This is where a lot of the surgeries were taking place. And the surgical theater was actually considered the ether dome and is historically preserved under that. On to Charles Jackson. Dr. Charles Jackson received his MD from Harvard. He was a physician, a chemist, a geologist, and a mineralogist. But this was very early into geology, so it was a little weird and not as practice for him. He did own his own practice, but left medicine in the 1830s to pick up teaching analytic chemistry, and that's where he came across Dr. Morton and taught him the chemical methods. There are conflicting stories about Dr. Jackson. He spent his entire life trying to take claim for other people's inventions. For example, he insisted that he told Samuel Morse about the telegraph and the use of the telegraph, and he felt deserving of the credit for that invention. It ultimately pushed him to insanity. Dr. John Collins Warren, who helped Dr. Morton with the neck tumor removal surgery, published an article in support of Dr. Morton against Dr. Jackson, stating Morton should get full credit because he ultimately applied his findings to surgery, and he spent the rest of his life in an insane asylum. So just some pictures. The left is Dr. Jackson, and on the right is him performing a tooth surgery. Dr. Crawford Long was a Georgian doctor. He was the first person to use ether in a surgery in 1842. I found somewhere else that someone else in January of 1842 used ether first without publishing, and he did it in March of 1842 without publishing. So that's another example of the lines are very blurred in this time. He spent years practicing and studying ether before actually publishing his findings. He observed the use of ether at the aforementioned ether frolics when people were getting punched or falling and not feeling any sort of pain. People were very skeptical at the time of his use of ether as well. They felt that he was maybe dabbling in some sort of witchcraft, or he was messing with the wrath of God. People felt that God gave you the pain, and if you were tampering with it in any way, you were going against his wishes. In 1849, there were many fights and arguments about the invention and the use of ether, coming from Jackson, Morton, and Morton's old partner, Wells. He just kind of gave up fighting about it and carried on with his life. He served as a surgeon for both sides during the Civil War. He had his own practice. He was a successful doctor. And a year after his death, in June 1879, the National Eclectic Medical Association named him as the founder of ether. He never witnessed his accomplishment, but he eventually did get named. Some pictures of him conducting surgery, a picture of him. The middle picture is him using a mask of some sorts and the bag, and the other one is using the cloth and just putting the cloth over the face and covering the nose and the mouth to perform surgery. Moving on to Lancaster County and how Lancaster has benefited from these medical advancements were the Atlee brothers. John Light Atlee graduated from the University of Pennsylvania in 1820 and practiced entirely in Lancaster, as did his brother. He was the vice president of the American Medical Association, and he gave an inaugural speech stating how proud he was to have served his community. John L. Atlee and Washington L. Atlee were known for their ovarectomies, in 1840s. They were very well known for removing both ovaries successfully and with low death rates. They basically have invented the idea of sponging someone's insides and draining the fluid that way, and then closing up after surgery rather than the popular way of flipping the patients over and just draining them, added to the trauma of surgery. One of their first successful ovarectomies was done on a kitchen table, which was also very popular. And John L. Atlee was threatened to be sued if the woman died and be charged with murder. So they had a lot on their plate to make sure that the woman was well. Kitchen table surgeries were so popular because of the lack of public hospitals as well as the lack of trained nurses. So doctors would just go to people's homes and perform these surgeries, or if someone had a private hospital, they would go and work on someone there. John Atlee was a general practitioner, obstetrician, and skilled surgeon. He perfected the ovarectomies, bladder mass removal, and taught anatomy and physiology at Franklin and Marshall in Lancaster. John Atlee worked to clear cholera from Lancaster County with the Sanitary Committee of Lancaster County to get clean water here. Washington Lemuel Atlee also had a high success rate with ovarectomies, had his own practice here, and served at the almshouse regularly. Both of them did. They spent a lot of time at the almshouse helping people. Here are just some pictures of them. I didn't find a lot of information. I felt like I would have liked to know more about them, but they were very successful in Lancaster and really projected us forward as a county all the way out here when other things are happening up in the Northeast. The Lancaster Almshouse was from 1800 to 1969 when it ultimately closed. It was the first place in the county, arguably the country, that provided public health care and social services. There was a major switch from in-home treatment centers to institutions in the 1800s, so this was a very successful organization for many years. It focused on many different areas in the county. It allowed for group observation of the poor, tracking interventions based on physical health, mental health, employment, and behavior. Their goal was to give jobs to the poor It encouraged them to live one day without relying on anyone else, relying on the community, living off of the street. People could work and pay, or they could work for their pay, but everyone was pretty much able to go there if they needed some sort of help. Jobs that were offered were working in the quarry, weaving, cleaning, caring for the children and the animals that lived at the almshouse as well. Black people were allowed to live at the house. However, it was segregated. Many of the people that were coming were slaves, looking for a free way to live. They were looking for a different way of life. Once segregation kind of ended, it wasn't so bad, but people were still separated. And Black people were often given the odd unwanted jobs for less pay, or they were giving the bottom of the barrel kind of jobs that no one else wanted to do. The Lancaster Almshouse Hospital provided the highest services from the best doctors and surgeons in the country, and they treated physical injuries and mental illnesses. They practiced malarial shock, which is injecting the body with malaria and then using quinine to treat it. Hydrotherapy, which brought your body down into the hypothermic state and warming them back up, and using insulin shock. They injected insulin when you were coming off of a diabetic coma. The almshouse was broken down into different sections based on the needs. They used all parts of the building. Different buildings were for where people lived, the basement where severely mentally ill people lived, and as it went up, as did the needs. People needed less and less things the higher the building went. Here are just a couple pictures of the almshouse. It's no longer standing. There's a section of the house that is still up and preserved, but for the most part, it's not existing anymore. But it was a beautiful building that really supported the community and offered a place for people to be, to work their way back up and to be successful. The American Medical Association that John L. Atlee was the vice president of, he was the vice president of that when he was 83 years old, was made up and is made up of students and doctors with the goal to promote the art and science of medicine and the betterment of public health. They urge the government to have people keep important documentation. This includes birth certificates, marriage and death certificates, anything that you received at one point. The AMA established the world's first national code for ethical medical practice and code of ethics. It urged people to pay attention to what medicines they were taking and the potential dangers. Like I said earlier, a lot of medicine that people were taking was labeled poisonous, and they were still taking it under the encouragement of their doctors. In the 1920s, Theodore Roosevelt brought in an act that required medicines to include warning labels and required media to report medical accuracy, to make sure that people were not misled. Black medicine is something that I've also been researching, and for a very long time, even into today, a lot of like fast or quick healing medicines are still on the market, but it was especially bad back in the 1800s and the 1900s, looking for a quick fix or a miracle medicine to heal everything. And those tend to just be incredibly dangerous. So they required people to read what they were taking and to have the media report everything accurately, or as accurate as possible. Overall, they're responsible for the fast-paced growing health and safety regulations in the country. So some ways anesthesia is studied today. Doctors now study how the brain is affected during anesthetic use. They've noticed that the brain circuits are affected, the oscillation patterns change, causing basically the blackout that you experience during anesthesia. That's how you forget the pain. If you notice, you just forget time when you're having your wisdom teeth out. You feel like you've been asleep. You haven't necessarily. Sometimes people are sedated, but your brain just stops recording, and they're noticing that. Harvard doctors use Ritalin to help patients wake up after procedures. Women tend to wake up faster than men that they found. In their tests, they use a scale 0 to 100 to kind of understand the use of anesthesia. 45 to 60 is ideal, 35 is too light or too deep, and 40 and up is considered waking up. They monitor that. Aside from like physical indicators that you are waking up or having issues under anesthesia, a BTS monitor measures the scale, and it was approved in 1996, but it is expensive and many hospitals do not use that. So like I said, anesthesiologists are trained to monitor people's physical signs, like heart pressure, heart racing, blood pressure, sweating, anything like that, a physical indicator. According to Duke researchers, women tend to be more aware during their surgeries, so they tend to feel things a little bit more, they hear a little more things than men, and ultimately they need more anesthetics to keep them under. For a long time, sex was never fully considered in surgeries, mostly weight for a dose, which makes sense. If you think about it, you would think that your weight does determine how much of anything that you would need, but in today's world, considering sex has become more and more popular, and understanding women's history and women's medical procedures are becoming more popular, and understanding why women feel things differently. I also looked into researching people with red hair under anesthesia. It's popular understanding to think that redheads do need a little more anesthesia to keep them under because of a mutated gene, which isn't completely inaccurate, but there has been very little research to fully prove that. The studies that I found had small sample sizes, 40 women with red hair and 40 women with dark hair. And measuring pain is already difficult, but measuring pain in women when everyone is feeling things differently is hard to understand. So the results were mostly inconclusive. In 2020, they did start a new study with larger sample sizes with men and women, and also testing different types of pain. Rather than just one kind of pain, they test shocking people, pinpricking people, things like that, to determine how people really feel while under anesthesia. But that is the end of my presentation. Thank you so much for everyone for listening and paying attention. I've really enjoyed my time here at the Medical Museum, and I hope you enjoyed.
Thank you so much, Haley. That was fantastic. And we do have one question for you. While we know that the Atley brothers had to have used anesthesia during their ovarectomies, a question has come up with, during this time, were women studied at all, or was there a different effect during the time that they would have been practicing?
Women weren't really studied as much. They just kind of felt that women didn't really feel the pain, in the sense. The idea that they could have children and be fine and experience that pain was not really studied. They didn't really study the effects of anesthesia on anyone in general. They just found that anesthesia worked, so they just used it whenever they could to protect the people and to protect their pain.
Okay. If anybody else has any other questions for Haley, please feel free to put them in the chat. While I give that a couple minutes here, I want to thank everyone who has participated and has donated to see this talk. We are a 501c3 nonprofit, so we are reliant on donations. So every little bit helps, and we really appreciate everyone who has donated to see this. So if you are interested in presenting a webinar or a lunch and learn, please feel free to reach out to us. You can check out our upcoming events or any upcoming lectures or webinars on our website. And it doesn't look like we have any other questions. So I'm going to say again, thank you to Haley for putting all that research together, and thank everyone.